Everyone, welcome again. And in this new chapter today, Neuroanatomy, we are going to discuss the limbic system. Limbic system is very important in making new memories, especially based on olfaction or the sense of smell. In this lecture, we're going to have an overview of the limbic system with its functions, structures, and components. We're also going to look at the Papez circuit, and in the end, we're going to look at the certain clinical conditions that are associated with the limbic system. So, what is a limbic system? It is a neuronal network that mediates the emotions and motivation, and it will also help in learning with and having new memories. To create new memories, this network is essential for the numerous psychological functions and play an invaluable role in processing and responding to the environmental stimuli. And everything is going to happen all subconsciously. So, what are the functional aspects? If you notice on the left side, I have arranged them into the alphabetical orders. So, that will make it easy for you to understand. So, functional aspects number one is attention. So, that will help us to keep a track of our surroundings. Number two is emotions. So, it will drive variety of emotions. So, that could include anger, happiness, etc. Then we have the feeding behavior. So it will help us maintain the body composition by keeping the account of the caloric intake. Next, we have a mating behavior. So that will involve in variety of actions, including sexual pleasures, to ensure the survival of the human species. The last one is memory. So it will involve with memory, especially in relation to the olfaction, and we will discuss that more in the oncoming slides. So, what are the components of the limbic system? So, limbic system is not a true anatomical lobe, but there are different components that actually make the limbic system, and they have different functions in different part of the brains. But when they come together, they make a limbic system, and these different aspects of the brain will have a different functions. So, the very first one is the cingulate gyrus. So, it is present on the medial aspect of each cerebral hemisphere, and it is just superior to the corpus callosum. Then we have the uncus and the olfactory cortex. So that is going to be closely related to olfaction or the sense of smell. Then we have the parahippocampus, parahippocampal gyrus, and hippocampus. We also have a subcallosal gyrus, which is just inferior to the corpus callosum. So there's two parts of right above the so corpus callosum is the cingulate gyrus. Right below is the subcallosal gyrus. Both of them are going to be involved with the limbic system. Then we are going to have a septal nuclei, which have a reciprocal connections from the olfactory bulb, hippocampus, and amygdala. And finally, we're going to have the last component of the limbic system as amygdala. So over here, you're going to look at the limbic system as a whole. You see the entire brain, which you're looking at the whole plane here. So you're looking at it from the medial aspect. You see this one right here is the corpus callosum. So over here on the top, right here is the cingulate gyrus, this entire thing. You have the fornix, you have the hypothalamus, you have thalamus that is connected with it. We're also going to have hippocampus, mammillary bodies, amygdala, you have the olfactory bulb, and then we have the septum right there. So, how does the olfaction or how does the smell or odors drives the primal response? So, this response is much enhanced in other vertebrate animals because they have a basic survival instinct, and smell is one of them. But since humans have evolved, this primal response is still present in them, especially if you notice the evolutionary response from over a longer period of time from hunter gathering situation to now into the modern. This basic olfaction is still present. So, all these systems get activated when they smell something. So for example, if you have a certain smell to your house, and when you enter your house, if something is different, if someone was cooking inside the house, then you certainly know, okay, this thing was cooking in my house, a certain dish that was cooking. So you have that memories that get activated there. So you get a stimulus or input to the olfactory cortex. That is the first step in the process. That will initiate the response, and there should be an input, and then there's going to be a trigger. That is through the primary olfactory cortex, which is the uncus. Then amygdala get involved. It is also involved with the olfaction. When there is an input to it, it will initiate the emotions. So, for example, you like a certain dish, and when you enter the home, there is a certain smell of your dish that you like is being cooking, and you become happy because you have that memory in your brain. Or disgust, which in return drives the behavior. So, what is the behavior then? So, you have hippocampus there. So, there is an indirect input from the hippocampus, and it is essential for the olfactory memory. So, in case we ran across the same odor that we didn't like, or we like, we are going to have an impact of it that we're going to feel in our body. Then we have hippocampus making a connection with the hypothalamus. So there is a connection between the hippocampus or to the hypothalamus that will initiate the visceral response, like increasing the heart rate, that happy emotions that come out, or emotion of disgust, or emotions of disgust that come out of you. Then we're going to have orbitofrontal cortex that will help in perceiving the odors. So what is hippocampus? We have hippocampus present right there. So it is the integral part of the limbic system. It is composed of a dentate gyrus, hippocampus proper, and entorhinal cortex. Location is basically present at the floor of the inferior horn of the lateral ventricle. Input gate is through the dentate gyrus, and the functional consideration is that it is important in the formation of a long-term memory and essential as we navigate spatially through the environment. Other inputs to the hippocampus is through the amygdala, cingulate gyrus, and the prefrontal cortex. We have discussed the prefrontal cortex when we were learning the cerebral cortex. The second component is the amygdala. It is another integral part of the limbic system. Location is it is present just anterior to the hippocampus in the medial temporal lobe. Functional consideration is it will connect an emotional response to the stimulus, and depending on the stimulus, the response vary. So after that the response is going to be imprinted in our memory. So it's going to have that emotional stimulus, it will get that, and depending on the stimulus, it will respond. So this will also drives the response, which can either be visceral, like increasing the heart rate, etc., or there's going to be a motor response, like moving to or moving away from the stimulus. So, for example, if there is a natural gas leak in your house, you are familiar with that smell, so you enter into it. The sudden visceral is going to be you sense a danger. The motor response is going to be like, I'm going to get out of this place. So now the next thing is going to be the Papez circuit that we're going to discuss here. So what it is, it's the interconnected network, which is going to connect many different areas of the limbic system that involves hippocampus, mammillary bodies, thalamus, and the cingulate gyrus, and it is associated with many emotional response. And this circuit will allows the memory to be stored based on the emotions produced by the stimulus. So let's look at the Papez circuit. So it originates in the hippocampus right there. And the hippocampus is going to be connected with the mammillary body right here through the fornix. You see the line going here? Sorry, going up right there, fornix. So it's going to go through fornix crus, fornix body, and fornix column and connect with the mammillary body. Now, the mammillary body is going to be connected with the anterior nucleus of the thalamus, and it is going to be connected through the mammillothalamic tract. The name suggests itself, mammillothalamic tract. That's how it gets connected. So now the anterior thalamic nucleus or anterior nucleus of the thalamus, it's going to be connected with the cingulate gyrus right here, and this is going to happen through the internal capsule. The cingulate gyrus is going to be connected back with the hippocampus, a long route that it has to take through this cingulum. So you see all this dotted line is basically the connection going into parahippocampal gyrus and torhinal cortex and going through the hippocampus again. So that is the Papez circuit. So what does the Papez circuit does? It is a modulator driver for the various emotions that include anxiety, fear, happiness, sadness, sexual pleasure. Now we're going to look at the clinical correlations, different diseases that could involve, and it could be associated with your USMLE Step 1 exam. So this syndrome is characterized by the chronic memory disorder This one right here is the Wernicke-Korsakoff syndrome. It is also called as the wet brain syndrome. So again, it is characterized by the chronic memory disorder. Pathogenesis, it happens via vitamin B1 or thiamine deficiency, and typically due to the result of the alcoholic abuse or alcohol abuse. There is a damage to the mammillary bodies and the dorsomedial thalamic nucleus. The symptoms of these patients is going to include difficulty in learning new information. They have inability to remember recent events, and since they cannot remember the recent events, they are prone to make up the events that they themselves cannot remember. So they go. So their imagination might be very active. The next clinical correlation is the Kluver Bucy syndrome. This is a very rare syndrome in humans, and it is characterized by the bilateral lesions of the amygdala and hippocampus. And the causes of this one is trauma and the syphilis encephalitis. Symptoms include visual agnosia, which is the visual disturbance, oral tendencies, the patient will tend to put things in their mouth, and hypermetamorphosis. Then there's going to be diminished emotional response and hypersexuality. Another one that we're going to look at here is the Alzheimer's disease, and it happens due to the severe atrophy of the hippocampus area. So, histologically speaking, it is characterized by the presence of the alpha beta amyloid, and in other histological findings, in the presence of the neurofibrillary tangles of the hyperphosphorylated tau proteins. And with the progression of the disease, there will be more global involvement of the brain structure characterized by the progressive cortical atrophy and the widening of the sulci. However, the occipital lobe is spared. So this is one of the features that you may encounter is the occipital lobe that is going to be spared. And this is the most common form of dementia. It has a late onset, occurs later in life, and then it has a early onset, so which is less common cases, 40 years of age and have accelerated course than the late disease onset. Symptoms include memory impairment, starting with misplaced item or becoming disoriented, like difficulty walking around the neighborhoods, difficulty with numbers. Patients are not going to respond effectively in different interactions, and there will be behavior change. So you look at the progression of the Alzheimer's disease right here. This is a healthy brain. You appreciate the ventricles right here. You see the healthy cortex. But in the Alzheimer's disease, the mild Alzheimer's disease, you're going to have you see that there is the diminished cortical atrophy, and there's a very less cortical atrophy. But when you're going to have a severe Alzheimer's disease, you see the healthy one right here, and this is the severe Alzheimer's disease that you find here. There's another comparison image right here. You have a cortex sulci, white matter present here, hippocampus in both situation. You see how atrophied the hippocampus looks, how atrophied the cortex looks, the ventricles have enlarged and everything. So you find this in the Alzheimer's disease. So with this slide, we're going to end our lecture here for the limbic system. I'm going to see you soon with another lecture. Thank you so much for joining in.